Hello everyone, welcome to my YouTube channel. My name is Brent. Nice to meet you guys. I'm a registered nurse as well as a med-surg and mental health clinical instructor. I teach at 2 local private nursing schools. I've been teaching for a little over 2 years, been a nurse for 6 years, and I'm now teaching full time. So I figured, why not jump on YouTube, teach a little bit. Hopefully, you guys learn something. Hopefully this is educational and beneficial, and let's just have some fun and see where it goes. So for today's video, I want to talk about mental health nursing because it is a little bit different from working on the medical floor. And actually, fun fact, before I became a mental health nurse, I worked on the telemetry floor as a new grad nurse. Prior to that, I was an EKG technician, and then something happened along the way. A good buddy of mine decided to refer me and recommend me to work with him at the psych unit, and I fell in love with psych nursing. But what I also found when I started teaching was that some of the students had some trouble in the beginning of their mental health term because they couldn't really grasp mental health nursing concepts. The language is different, the mindset is different, the priorities are a little bit different. There's a legal side to it, and then the medications destroy students. The naming and the suffixes do not follow the normal way that you guys have learned when you were in nursing school. So it's completely different. But in a nutshell, mental health nursing is taking care of patients who have mental illnesses, right? So mental illnesses have exploded on the scene. Actually, since the beginning of the 1900s, we've been talking about it here in America. And then, from then on, we started learning a little bit more about it, slowly but surely. And in more recent years, we've had athletes, actors, celebrities talk about their battles with mental illness. Mental health is everywhere. If you end up working in the emergency room, you're going to see it first and you're going to see it worst. If you work in OBGYN, labor and delivery, you're going to see it with moms who have postpartum depression. If you work in a drug rehab center, we know that drugs and alcohol can exacerbate mental illnesses. So you might have a patient who is under the influence of some type of substance, and now they're seeing things, hearing things, so on and so forth. If you work at the VA and you're working with veterans, you may see patients there who have PTSD. But despite all of the advocacy, despite the years of research, despite advances in psychology, medicine, and science, we still don't understand mental illnesses as much as we should. And unfortunately, there is no magic pill. There is no cure for mental illnesses yet. And I tell students this all the time is I liken mental illnesses to cancer. Whereas cancer can go into remission, mental illnesses, they technically don't go into remission, but there are times where people are able to cope better, they're more resilient, and that can be because of really strong support groups, family, friends, therapy, medications, and just how resilient they are as a whole. But mental illnesses don't truly ever go away. And it's something that you're going to have to cope with for the rest of your life. And hopefully you can get a handle on it. But if you are stable, you're still able to go to school, still able to hold a job, be successful, do all the things you want in life, get married, raise a family, retire, so on and so forth. Despite all that, we have these stigmas, these biases, these beliefs out there that are still prevalent. Right? We look at someone who has a mental illness, we think that they're crazy, right? We think that they're violent or dangerous. We think that they're not smart, or we think that they're a drug addict, right? Those are the 4 common misconceptions that I hear all the time, not only from students, but also from seasoned nurses. And we got to get those words out of our vocabulary because that is not necessarily the case for every single mental health patient that you're going to see, right? So I had this mental health instructor, wonderful woman. Her name is Professor Katz. And she would always tell us before we would go on the unit to check yourself before you wreck yourself, right? She loved her 90s rap and hip hop. Warren G's Regulate, I believe, was her ringtone on her phone. But she would always tell us to check your biases at the door. Make sure you're not bringing any of those preconceived notions, those judgments about these patients on the unit, or else you're going to get wrecked and you're not going to have a good day. All right. So I just want to offer that same advice to you guys. Check yourself before you wreck yourself, because you do not want to start treating these patients like trash, right? You have to be able to separate the illness from the individual. We treat these people with dignity and respect. And if you are not doing that, work somewhere else. All right. Second thing, of course, which is the mainstay, the number one important thing about mental health, which should have actually been number one, is this whole idea of safety. Safety is paramount. Safety is number one. Safety is king when it comes to mental health as a whole. All right. And we're talking about safety for you, safety for your coworkers, and of course the patients, obviously. The goal at the end of the day is for you and your coworkers and everyone to, go home on their own power and in one piece. Now, this does not mean that the patients are more dangerous or more violent than anyone else. Once again, that's another stigma that you got to leave at the door. Check yourself once again. It just means that these patients are unpredictable. You don't know what they're going to say. You don't know what they're going to do. Unpredictable does not mean that they're dangerous or they are violent. But of course, you still have to be cautious and be careful. And this right here is what makes mental health nursing difficult for a lot of people. I had a former manager of mine tell me that mental health isn't for everyone. I 100% agree. I've gotten hurt before. I got hit across the face. Patient got me right across the face. My glasses flew off. The screws broke off. The lens of my glasses popped off on the floor. I had a nice abrasion here on my right temple and a nice gash across the bridge of my nose. Blood everywhere. No broken bones. No scars, as you can tell. No, nothing like that. The patient didn't punch me. The patient did not have a weapon, thankfully. And I didn't get hit hard enough where I blacked out or I fell on the floor or got a concussion or anything like that. But I did get hit. So safety is number one. All right. And then the last part that I want to talk to you guys about, number three, the two main pillars of mental health nursing. This is more to the acute side. This is, for those working in a, short stay acute facility. This is psych emergency room. This is psych urgent care. Your mainstay treatments, it's going to be medication management and behavioral modification. Yes, therapy is important, but there's a time and place for it. When the patients come in to see me, they're in crisis, right? Their psychosis is so bad. Their stress is so overwhelming. They're not able to cope. They don't know what to do. They need immediate help. They have thoughts, or they have tried to, to kill themselves and or hurt someone else. Sitting down on a nice red fluffy couch talking about your childhood trauma or your past, growing up, that's not going to be effective. These patients are way too wired. They're way too restless. They can't concentrate. They won't be able to focus. They have a hard time following simple directions. They won't be able to undergo therapy. They need, help immediately. We're going to have to nip it in the bud before the situation gets worse. They escalate, they become violent. We have to medicate these fine patients once they're stable. Now would be the perfect time to do that cognitive behavioral therapy, right? But while they're in crisis, we have to medicate them. We have to stabilize them. We have to make sure that they are safe. So therapy is great, but we're gonna have to medicate them to get them to that point. So overall, you guys, that's pretty much, 3 quick things about mental health nursing. And this is a great field to work in. Once again, even though I do recommend and I do suggest it, of course, you guys can tell the bias. I know it's not for everyone, but it is a great field. It's an, ever-growing field. You're dealing with, patients who emotionally are in distress, behaviorally unpredictable, cognitively impaired. Now, there's not a lot of medical, skills that you're performing. We're not working with IVs or any lines or Foleys, because those things can be used as weapons, for the patient to hurt themselves or others. But what you lose in medical skills and not being able to practice them all the time, you gain in being able to talk to people and de-escalate situations and be more of a people person, and be able to use your words, to help others. It's great. But if you ever plan on working in mental health, we will welcome you with open arms. I'll be the first one to do so. Patients too will welcome you with open arms, but just once again, safety is number one. Don't get too close. That's pretty much mental health nursing in a nutshell. I hope this was educational and beneficial for you guys. If not, I hope that this was just entertaining. And, thank you so much for hanging out with me. If there are no comments, questions, concerns, or complaints that can be expressed in a therapeutically communicative manner, hit that like button and that subscribe button for, future videos. If you do have those said comments, questions, concerns, or complaints, well, there's a comment section below. I'd love to hear what, what's on your mind. But until next time, take care of yourselves, and I'll see you in the future. Peace.